seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our HealthyU Webinar Series. Today's topic is 2023 HealthyU after 2022. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will always remain anonymous. Today's presenters are Daphne Baldwin-Cornrich and Barbara Brogleworth. Daphne has been a registered dietitian/nutritionist for over 30 years. She is a board-certified specialist in obesity and weight management, as well as a certified health coach. Daphne has worked in a variety of clinical and outpatient settings, and she has been working at Mather Northwell Hospital since 2010, specializing in bariatrics and weight management. She loves the science of nutrition and to have the ability to provide education and support to patients to help them focus on behavior changes that can lead to permanent lifestyle changes. Barbara is a registered dietitian nutritionist for Mather Hospital's Bariatric Center of Excellence. Barbara earned a Bachelor of Science degree from Queens College, completed a dietetic internship at Stony Brook University, and received her master's degree in health science from Stony Brook University, and is an ACE certified behavior change specialist. In addition to supporting our bariatric surgery patients, Barbara also educates community members through Mather's medical weight management program, helping others find wellness through balanced nutrition, physical fitness, and a healthy lifestyle is central to Barbara's work. Well, thank you both for presenting today. I'm just going to bring up your PowerPoint and then we'll get started.
Thanks, Jonathan. Okay, so we're going to be talking about our comprehensive medical weight management program. This is Barbara. Thank you all for joining. Next slide, please. We don't have anything to disclose. Next slide. So the learning objectives to today, we want to examine how things like hereditary, activity level, and body composition influence a person's weight. We're going to identify health problems that can be associated with being overweight and underweight, and summarize strategies for losing or gaining weight. So what is a healthy weight? So I want to preface it by saying a healthy weight is not what we weighed when we were 20 nothing. A healthy weight is not what the billion-dollar diet industry tells us it is. The diet industry relies on us to feel badly about ourselves. They sell diet solutions that are either unattainable or sustainable, and when they don't work, the marketing strategy is to make the individual feel bad, like they failed somehow. So diet companies want their customers to constantly feel the need to go on another diet, when in fact 95% of all diets fail. So diet culture equates thinness with health. Diet culture shames us into believing that we're somehow broken if we're in a bigger body. Diet culture leads to disordered eating. It can begin as early as 10 years old. It promotes the intake of harmful substances like over-the-counter weight loss pills, laxatives, colonics, all to promote weight loss. Promotes fad diets that are often way too restrictive to follow for long term, and they don't provide sustainable lifestyle habits. So successful weight management really starts with accepting the body you were born with, and then taking steps to achieve a healthy weight that's within your own body limits, one that's going to help you stay healthy throughout your life and minimize your risk of lifestyle diseases. Next slide. So, we have to acknowledge society's role in weight status. As we look back, our ancestors didn't have to worry about things like thyroid, gut, heart disease, cancer, or any of the issues that are top of our mind today. What's changed? Well, for one, we're working a lot more hours. We've got both parents in the family, if there's children, both people have to work to make ends meet. And then there's, running around taking care of our family. So we have to acknowledge that that's part of it. We're more isolated even before the pandemic. We get a lot of conflicting advice on nutrition information. And I think most and foremost, we are heavily marketed to overconsume highly processed foods. So food marketing is a powerful driver of these ultra-processed food consumption campaigns, with social and new media resulting in a close interaction between consumers and brands. In fact, in one study in Brazil, they're starting to consider to develop policies that model the UK, where they actually have a ban from 5:30 to 9 p.m. on paid advertising that are advertising drinks and foods that are high in fat, salt, and sugar, because they recognize that these messages are coming through and they're so subliminal, but it's driving us to overeat. Next slide. And then I think it's also important, as clinicians, we also have to take into effect that weight gain is multifactorial. So we talked a little bit about the environment and lifestyle, but let's talk about genetic factors. So what we know today is that there's about 400 different genes that have been implicated in the causes of overweight or obesity. And genes can contribute to these causes in many ways. They can affect our appetite. They can affect our satiety. It means that that's our sense of fullness. It can affect our metabolism, our food cravings, our body fat distribution, and the tendency to use eating as a way to cope with stress. Then we've got our physiological factors, things like our basal metabolic rate. That's the number of calories we're burning at rest. There can be changes over our lifestyle. We have to take that into consideration. Hormones, our stress hormones, or women who are postmenopausal or perimenopausal can impact weight and also our appetite, our sleep quality, stress management. And then from a behavioral perspective, we know that many people, will consume these ultra-processed or hyperpalatable foods as a way to comfort themselves or to relieve stress. And then gut health. So there's a lot being studied with our human microbiome right now. And we know that this bacteria in our gut, this microbiome, can also impact the production of our hunger hormones, such as ghrelin, which is in control. It tells us when we're hungry or full. And an unhealthy gut microbiome can increase inflammatory markers, which we know can also lead to weight gain. And then medications, some people are on medications for debilitating conditions, and some of those medications can either increase appetite or lead to weight gain. So we have to take that into consideration. And then last, injuries that limit physical activity. Somebody could be in a car accident and, totally not their fault, but now that it's injured their back, that impacts their ability to move more. And that can also impact what our current weight status would be. So this overconsumption of hypercaloric food, you may have noticed that I'm using words like hypercaloric and hyperpalatable and ultra-processed, and I'm not using words like good or bad, because there's no moral judgment when it comes to food. Let's look at this objectively, right? We know that ultra-processed foods lead to overeating and weight gain. They're hyperpalatable. It means that they actually appeal to the reward center of our brain and then promote overconsumption. And you can see in this picture on the right, where they can do functional MRIs that actually show those reward centers in the brain lighting up, similar to drugs. That's the reward center. But unlike drugs, these hyperpalatable foods are available anywhere, anytime. You can't walk into 7-Eleven for just to try to get an innocent cup of coffee in the middle of the day without being accosted by the cookies and the donuts and the treats and the creamers and things that you may not have even been thinking about before you walked in. So we have to take that into consideration. Now these foods, these hyperpalatable foods, what they do is they contain really large quantities of sugar, salt, and saturated fat. And what the research shows is that we tend to overconsume about an additional 500 calories if we're consuming those foods. So if you think about it, let's take the equivalent of 500 calories, and let's say maybe it's probably 3 large apples or 4 medium-sized apples, right? let's put that on the left hand. Now on the right hand, let's take the equivalent of 500 calories and let's say a piece of chocolate cake. So which one can we consume faster and more of? Well, if you're like me, I could probably eat 2 pieces of that chocolate cake and still not feel full. But if we tried to eat, 4 or 5 apples at one time, we'd have a bellyache because of all the fiber and the water content and, all of those good nutrients that are in the apple are going to keep us fuller longer, where anything that's hyper palatable, we're going to be able to eat it a lot faster. Doesn't require as much chewing. We can eat it faster. So it leads to this overconsumption of these foods. Next slide. Okay, so having said all of that, we do know that there are medical complications to being overweight. We know that that having extra adipose tissue or extra fat around our body it can promote inflammation in the body, this chronic inflammation that doesn't go away, and it can lead to, some of the conditions that are listed or these medical complications on this slide. Next slide. Here's the good news though. A lot of people feel like if they're battling their weight that they have to lose, this enormous amount of weight to reap the benefits from a health perspective. So let's just look at our blood sugar control. We'll take diabetes. So prevention. If you can lose 5 to 10% of your body weight, you can lower your risk of developing diabetes by 58%. And in terms of management, if you have prediabetes or type 2 diabetes, or also known as insulin resistance, losing 5 to 10% of your body weight can help improve your blood sugar numbers. In terms of heart health, losing just 10 pounds can help manage things like high blood pressure. Weight loss reduces the strain on our heart. So being overweight puts this extra strain on our heart, which could increase the risk for developing things like high blood pressure and damage to our blood vessels. But again, just losing 10 pounds, our body will respond very positively to that. And then in terms of bone and joint health, research shows that losing just 10 pounds would relieve 40 pounds of pressure from your knees. So again, we're not talking about a lot of weight here. All right, so I'm going to turn it over to Daphne, and she's going to talk about our medical weight management program here at Mather. All yours, Daphne.
Thank you so much, Barbara. So as Barbara just reviewed, we emphasize that weight management is more complex than just what we eat. Our classes are designed to build awareness around our choices and environment how they impact our behaviors and how we can take back control. Next slide, please. What makes our program unique? Okay, what we are is a medically supervised weight loss program that is a joint effort between our patients, the physician, and the dietitians. We emphasize lifestyle changes based upon the principles of the Mediterranean meal plan. What we're not about rapid weight loss, fad diets, eating the same thing, rigid menus, and as Barbara put so eloquently, judging people based on the food that they choose to eat. Our vision and our mission. Our vision and our mission is to serve the needs of our community by offering a multidisciplinary approach to medical weight management. We've been serving our community since 2014. We've helped approximately 750 community members lose weight and learn long-term behavior change. Our program focuses on the Mediterranean meal plan that incorporates good dietary protein, healthy fats, and a moderate exercise program. The Mediterranean diet has over 50 years of research behind it. And as you saw that screen with all the disease that can happen due to being overweight, this Mediterranean meal plan helps so much with diabetes, people with hypertension, inflammation, helps with gut improvements. So a whole host of evidence, and it's what we do have some control over by nourishing our body and making proper food choices can really help either control those disease states that we have or maybe prevent them in the future. We also follow, I'm sorry, do you mind going back to the other slide? Thank you. We also follow the National Weight Registry, the National Institute of Health and Academy of Nutrition and Dietetic Guidelines for weight loss. Our target population are those patients who have a BMI greater than 30 with or without comorbidities, or a BMI of 27 to 30 with comorbidities. And when we're speaking of comorbidities, if you have a history of diabetes or a history of hypertension, hyperlipidemia, and sleep apnea. Next slide, please. So we really want to personalize weight loss in a program. Our centerpiece of our weight loss program revolves around that personalized medical nutrition therapy. On average, our patients lose anywhere between 7 to 10% of total body weight. At the initial visits, all patients will undergo a comprehensive nutrition assessment and an assessment with the physician. We collect the following information to develop that personalized, individualized program. We take your weight, your height, your weight history, eating habits, your medications reviewed, your past medical history is reviewed to help to individualize that nutrition plan. If you decide to join a program and you've had recent blood work within the last 6 weeks, we ask you to bring that with you so our physician can review your blood work. And if you haven't had recent blood work, we will give you a script to get a comprehensive metabolic and lipid panel. Next slide, please. Thank you. So our components are weekly nutrition education for 10 weeks, again, focusing on behavior modification, physical activity, supervised by a physician. We also have weight loss medication to help augment weight loss, which may be available based on your conversation with our physician. But we can't emphasize enough that just taking weight loss medication without being in a medical weight management program is not going to be the best route. First of all, it's highly recommended because if you just take the medication, yes, it will help with your appetite, may help with your cravings. But if you're not learning those with the education that's provided with the program, you're not learning to make those long-term behavior changes that eventually become permanent lifestyle changes. So that's a conversation that you will talk with the physician during, if that's something that you're interested in. So next slide, please. So we have a structured 10-week classes led by Barbara, who is very passionate about our education. We talk about nutrition, cognitive, and behaviors to help promote sustainable weight management. If it's virtual, we've only had virtual classes because of the pandemic for a while. We just now have a hybrid part where we have some on-site classes and we also have our virtual component. We also send weekly emails with education material, and the classes really focus on the education. It's not just about the calories, it's about the quality. And Barbara does an excellent job of explaining how the food we choose can really make a big difference on how our bodies feel, how we didn't even realize that how important avoiding added sugars, and we have people that stop and their inflammation goes down and they feel so much better. We also talk about stress management, social support, stimulus control. Next slide, please. So here's the rotating class schedule that we have. Our classes are given on Wednesdays, 11 o'clock class, and there's also a 6th one. And again, they're virtual, and also we have on-site classes, the hybrid. So since the classes rotate, your first class could be someone's 4th class. So this is the rotating class schedule. We have a class on sustainable habits, habit formation and goal setting, the importance of physical activity and lifestyle behavior. We have a whole class on triggers and reinforcers, which is a big thing that mindful eating is such a key for success. Reading food labels and portion distortion, a whole class on the benefits and what is the Mediterranean meal plan, fiber and probiotics, dining out and alcohol, and those bites that sometimes we just don't count throughout the day. Next slide, please. At the end of our program, you will follow up with the registered dietitian and also the physician, and we also do a metabolic analysis and discuss our maintenance program, which I'm going to discuss a little bit later. So the metabolic testing measures an individual's metabolic rate by determining the actual resting energy expenditure, namely the amount of calories burned while in a resting state. It does this by measuring oxygen and carbon dioxide exchange, a process called indirect calorimetry. This will provide information of not only how many calories we need at rest, but also how many calories we burn with exercise and also those daily activities that we do all the time, how many calories we burn. So it's the most objective tool we have to come up with what would be a good calorie intake if you want to maintain weight or lose weight. We do this test in our office. It's a 10-minute test, and it's very interesting. And that's included in our fee. Next slide, please. So after you're finished with the 10 weeks of classes and the follow-up and the metabolic analysis, we really encourage that you join our maintenance program. As most of us know, that maintaining weight not only it's usually harder to maintain the weight that you lose than losing weight in the first place. So there's lots of research which has shown that many people who lose weight will eventually regain the weight that they have lost. Long-term weight maintenance programs that provide support and accountability have been shown to be a helpful tool for successful maintainers. Our maintenance program fee is $80, and that includes 8 classes over 16 weeks, which builds on the education provided in the weight management program classes. And we've had numerous people that join multiple times our maintenance program and are very successful.
For several
and
years
also
even.
Another 4 months of kind of being immersed in the education. We've had people might have finished the program, maybe only lost like 5 pounds, and then everything clicks towards the end, and when they do the maintenance, are very successful. So we really promote that. And next slide, please. So the program fee for the medical weight management program is a $220 out-of-pocket fee. That includes your nutrition assessment. It includes the 10 consecutive classes that's delivered by Barbara, a registered dietitian, also certified in behavior change, and also our follow-up appointment at the end of the program, and it also includes the metabolic analysis. So when you put everything together, it's very reasonable. The doctors, we always verify insurance, because when you see the doctor, you would probably pay the co-payment based on your insurance. Next slide, please. So this is our team. I'm Daphne. I oversee the program. I also do some maintenance classes, education, hop in if Barbara's not available. Barbara does majority of providing our education, the teaching, and very, very knowledgeable about the science of nutrition, and just is very passionate about what she does. Same as Danielle. She also does our nutrition assessment, behavior change, also very knowledgeable, in yoga and meditation. And then we have Donna, who helps us just keeping ourselves organized, keeping the patients, making sure their appointments are all set. And in addition, she's our high-techer, that if someone's in virtual classes or having any issues getting on, Donna is always there, providing tons of recipes. She's just wonderful. And we're so lucky that we all have the same goal, and is that to provide the people that join our program with the best that we can do to provide the best education and provide support, so we can help everyone meet their needs and make permanent lifestyle changes. And we get so much satisfaction back from the patients that we've had in the program, and how supportive they are to each other. Which is amazing, and we really appreciate that, and that just makes our job just so much worth it, that we have such a population. And of course, if we know that the education is for everyone, if anybody is struggling or needs to see us, you could always call, you could come in, and we can address those issues privately. We are there for you. Just wanted to let everyone know that. Next slide, please. So here's our phone number if you want to learn more about the program, 631-686-2513. We're located in the Medical Arts Building at Mather Hospital, 625 Belterre Road, Suite 201, Port Jefferson. And thank you for coming to this webinar and learning about our program, and we'd be happy to take any questions, Barbara and myself.
Yes, thank you both so much for the presentation. If anybody has any questions, you can enter them in the Q&A feature at the bottom of your screen. All questions are anonymous to protect your privacy. Daphne, Barbara, we'll give it a few minutes to see if anybody has any questions.
Okay, thanks,
Thanks,
Jonathan.
Jonathan.
Of course.
Daphne, I think you did a great job covering everything. Maybe they don't have any questions.
Or you, Barbara, too.
All right, we have a few questions coming in. Are you able to see them, Barbara or Daphne, or do you want me to read them out to you?
Yeah,
If you
I
could
can
read them,
see
that
it.
would be good.
All right, the first question is, what is a Mediterranean diet?
You want to
So
talk to
I
that,
can
Barbara?
answer that if you don't mind. Sure. So it's a meal pattern that's based upon all of the countries along the Mediterranean. It's been studied for over 50 years, but it's really plant forward, if I had to say. So when I have patients in this class, if they don't want to eat the Mediterranean way, I'll say, if you do a stir fry with a lean protein, brown rice, and lots of vegetables, that's the principles of the Mediterranean diet.
And I would just like to add with what Barbara said, that we meet everybody where they're at. If someone, like Barbara just said, if someone said, I can't be on a Mediterranean meal plan, I don't like fish. There's other things that you could do, avoiding those highly processed foods. So we promote it, but we individualize it to meet the specific needs of the individual patient or client.
Right. We give 2 meal plans in the initial consultation that are based, it's a 4-day meal plan that's based on the principles of Mediterranean diet, but then we can tweak it. And we didn't mention that our patients can actually track their intake on this customized app. So we can pull up reports. So if I have somebody that's tracking a couple of minutes before class, I can pull those reports, see everything, and then we can tweak things. So it's very user-friendly.
And it's free. It's a free app.
Right.
All right, that kind of leads us into our next question. Are there any programs for those who have other dietary needs? And I believe I saw with reflux.
We could certainly make recommendations. Daph, do you want to speak to that?
I said we could make recommendations, but anything like specific disease states, like it helps with majority, but we can individualize things, but we would want to make sure that someone would follow up with their physician if there's anything that we'd have the whole history. Like we don't do people that, like maybe are on hemodialysis, not that we couldn't, but it's that the education is for everybody. Everybody could benefit from the education, but if there's something more strict, we would just need to have more information prior to, committing that we could do it and have the time for that one-on-one. They might do better doing a one-on-one with a dietitian professional that just focuses on a specific disease state.
If you have Northwell Insurance, is the fee covered?
No, it's $220 out of pocket.
Okay.
Right now.
Can you attend if you received the gastric sleeve surgery?
Absolutely.
Is sushi on the Mediterranean diet?
Sure.
If it was with brown rice, absolutely. And you had some seaweed salad or edamame on the side, that's principles of the Mediterranean diet right there.
I have IBS. Can I still eat the Mediterranean diet?
Well, again, that would be individualized. You would be able to do components of it, but it's something that we would address at your consult. And again, what works for you.
Yeah, because IBS can be, there's so many different foods that are individual or specific to the individual that can be irritating. So knowing what those foods are, we could help work around that. And we do have, I have had people over the years in these classes that do have certain restrictions when it comes to food. Maybe somebody's lactose intolerant. Mm-hmm. That's okay. We can think about other ways to get calcium in somebody,
Does the program start at any particular time or date?
No. Well, what we would do first is if somebody was interested, we would have to schedule the nutrition consult with the registered dietitian and the doctor. But anyone can start, like, again, it could be your first class, it could be someone's 8 classes, so the classes keep rotating. The most important thing is if someone's interested and, knows that it's just, the fee is out of pocket, $220, what they get for it, is to make that consult. And then after the consult, then we can jump right into the classes.
What is the app that has the Mediterranean diet info?
I'm sorry?
What is the app that has the Mediterranean diet info?
Oh, it's not about I think what Barbara was saying, we have a app, it's called the Baritastic app. And once you join the classes, that's a free app, anyone can use it. But once you come into our program, there's a code that connects the person that's using the app to our practice so we can look at what you're eating and help tweak things and provide suggestions based on the food record. It doesn't go into the Mediterranean meal plan, but there
Blood
is
tracker.
a tracking device, and there's a lot of good resources on the app also.
I
And
have been
also, I think Barbara, you did, or Danielle did a HealthyU on the Mediterranean meal plan also.
Yes, yes, yeah, a couple months
So
ago.
that's always available too.
I have been diagnosed with NASH, NASH. Would this be a problem? Would this program be good for me?
Yes, yes. Mediterranean meal plan has been promoted to help with NASH. Again, everything's individualized. We have to like get all your history and medications, but it's been research has shown that it's been beneficial.
Just clarifying, the $220 is at first, and then $80 for maintenance program.
Correct. So the 220 is what's going to give you the nutrition consult, the 10 consecutive classes, the follow-up appointment with the dietitian, and also the metabolic analysis. So that gives you about 3 months in the program. Then if you choose, we recommend it, but it's your choice. If you want to do the maintenance program, that would be $80 for 8 classes over 16 weeks. And it's a very reasonable price. And then some people say, maybe I'll take a month off and think about it and want to rejoin in a couple of months. It's up to the person at that point.
Do you help with planning meals for the week? And do you have to write down what you're eating? Also, what exercises are you recommending?
Again, that's a very personal with the activity, what people are, walking. We have to meet people where they're at.
Right.
Also, what Barbara was saying earlier, we give 4-day meal patterns when you come for your consult based on the Mediterranean principles. But again, we work with you to make sure it's something we have to meet where you are. It's one thing for us to tell you what to eat,
Right.
but that's not going to help. We want to give you the tools that you are in control of your own food environment and making the best choices for you, not just to say I could do this for 10 weeks. I'm just following a list. And then all of a sudden you're not in the program anymore. And it's like, okay, what am I going to do? I'm tired of this list. It's learning the behaviors that's going to help with the success.
How is this different from the meetings pre/post gastric surgery from 2019?
Well, that's a whole different, there might be different requirements based on someone that had bariatric, again, individualized because you have bariatric surgery. So this is a different meeting. Are you talking about here or at a different facility? Are you talking about support groups or education?
I'll give it a few moments to see if they respond back. Yes, here.
Well, we have programs here. I know right after surgery, you can see the dietitian up to a month. I'm sorry, up to a year as part of the program. So I'm not sure when you say the differences that.
Well, we do offer classes and other programs that are specific. Their education, some of it overlaps because we do talk about the principles of the Mediterranean diet in the Back on Track program and in the Maintenance Action program. So some of the material does overlap.
So Barbara just said there are programs specific for the bariatric patient to help.
Okay,
That's what I'm sorry, Jonathan, we want to hear from people that if someone had surgery to be able to and feel like they regained weight, there are programs that are available here to help with those issues. And it takes a lot for people to want to do it. And we really admire those who come back.
All right, so that seemed to be the last question. I'll give it a few seconds to see if anybody has anything else. Oh, another one. What amount of weight is typically lost in the program prior to maintenance?
I'm sorry, I missed the first part.
What amount of weight is typically lost in the program prior to maintenance?
Generally between 7 to 10%. That's the average. But it depends what everyone's doing too. It's very individualized, but the average is 7 to 10%.
Okay. That was the last question for now. I'll give it a few seconds here if anybody has anything else. All right, that seemed to be the last question. Sorry, no. Will this recording be shared to us at a later date? Yes, it will be on our website. It'll be on our YouTube channel by the end of the day today. All right. Well, thank you everybody for joining us today. If you have any additional questions, you can please email us at matherhospital@northwell.edu. Once you exit the webinar, you will see a link to a brief survey. If you could please complete the survey, your feedback is extremely important to us and helps us plan our future programs. If you're interested in seeing past HealthyU webinars, you can visit us at our website at www.matherhospital.org/HealthyU. I want to thank you both, Barbara and Daphne, for a great presentation. And enjoy the rest of your day, everybody.
Thanks,
Thank
guys.
you,
Thanks,
everybody.
Jonathan.
Thank you,
Take care.
Jonathan.